This program is brought to you by the Georgia Neurosurgical Institute. For over 50 years, rendering neurosurgical care to patients of all social conditions, treating complicated problems involving the brain, spine, spinal cord, and peripheral nerves, endeavoring to encourage quality care, medical research, innovation, and education on a local, national, and international basis.
Good evening. My name is Joe Sam Robinson, and I'm pleased to have with us tonight Bitsy Stanford and Lee Langley. And tonight we're going to talk some about organ donation. And well, let's see. Bitsy, why don't you talk about why you're here tonight, if I could ask that question.
You can, thank you. Thanks for inviting me and LifeLink to have us on tonight. I had a kidney transplant June the 8th will be 12 years ago. I found out in 1997 that I was in renal failure, and I had 2 years where we just did some lab work, blood work, and a diagnostic test. And in 1999, I went to Piedmont Hospital for an evaluation and was back in less than 45 days for my transplant.
And so that's been a real life-changing experience for you, hasn't it?
Extremely so.
Yes.
Extremely so.
Now, yes. Now I'm going to ask Lee, who you're the assistant, or you're the associate director of LifeLink here.
Yes,
is that correct? And so you, in many ways, participated in this miracle that happened. Is that right? So,
yes. LifeLink is the organ procurement agency for the state of Georgia. We're one of 58 in the country. We cover the entire state of Georgia and 2 counties in South Carolina. And our mission is to work with the hospitals to identify potential organ and tissue donors and to have them refer these patients to us, so we're able to speak with the families and give them their options of organ donation or tissue donation.
So what I might say, just speaking at this from a medical point of view, this has been an extraordinary advance that's happened over the past, I would say, 40 years or so. And it's starting out just from a very small beginning. That's become a linchpin for many people, redeeming their lives and their families. It's a tremendously great thing. And have the number of organ donations increased locally and over the years in different parts of the country?
Yes, slowly but surely the donation is increasing. More and more people are learning about it. More families are being touched by not only having family members that receive the gift of life, but also knowing friends and families that have actually donated their loved ones' organs to help individuals in need of organ transplants.
Now Lee, sometimes I'm somewhat dismissive of the efforts of our legislators for whatever, making a better world, but actually they've done something pretty good in the state of Georgia. Is that right? With the legal underpinning for doing this and a driver's license, and maybe you can talk about that, some of the legal underpinnings for this process.
Well, what has happened in the last 2 years, legislatures revised the Anatomical Gift Act, and what that did was it ensures that when someone signs up to be an organ donor, we try to fulfill their wishes if they are deemed a suitable candidate to donate their organs or tissues. We talk to the families, we let them know about their loved ones' wishes and how they can honor their last wish by helping us with the donation process and giving us the medical social history, which is much needed for the donation process.
So this is on your donor status can be on your driver's license, is that right? Or maybe you can talk about that.
When you sign up, when you go to the to get your driver's license, they will ask you, do you want to be an organ donor? They will put the sticker on your driver's license, which indicates you want to be a donor. Also, you're able, one of the other things that we were able to do 2 years ago was to create a donor registry. And you are able to go on the website and sign up as an organ donor.
Yes.
It gives you a lot of information about what you can donate, how you donate, and that is www.donatelifegeorgia.org. And it's a great website. It's a lot of information. I would encourage the viewers to go and look, even if they've signed up on their driver's license, because it gives you a lot of links to other organizations.
Yes. And this really is, I won't repeat a commonplace, but there's just nothing you could do in many ways a more noble gesture than this, to let your organs save the life of another person. That's very a Christ-like thing to do. And Bitsy, in your life, that's made a tremendous difference. I mean, how did you come to your situation? Did you discover you had problems, or what happened?
I was perfectly healthy up until age 34. In March of 1997, I had the flu, just the regular common flu, where I took Tylenol for a couple of days, and when I didn't get better, I went to my doctor, and thank goodness he knew me well enough that it was not just the flu or the effects of, that I was not recuperating from fast enough, or how he thought I should, and he did blood work, and because we had no family history of anything, no cancers, no renal disease, kidney disease, anything of that sort. And but with that one tube of blood, it changed my life, mine and my husband's lives, that as we knew it. And when I woke up on Monday, June the 7th of 99, I just took an occasional Tylenol for a headache. But when I woke up on June the 8th, 1999, I had many, many IVs, and a week later when I was discharged home, I was on 40 some odd pills a day, and now my daily regimen includes 19.
Well, this is when you had your kidney transplant?
Right. Initially it was 40 some odd, and now my daily regimen is 19 pills.
Well, why don't you describe a little bit of how this process went for you? So suddenly you're a healthy person, trying to tap dance 3 times a week, just enjoying life. Life is fun. And
we did. My husband and I, actually, one of your employees, she always wanted my husband and I to adopt her because we very spontaneously travel. My husband and I made no plans ever. If
you might just get on a jet plane and off you go.
We go to Atlanta, lay down the American Express, and we're out.
Okay, well that's good.
Or we would wake up, and my husband has got a cousin that's a professional baseball player, and if we wanted to go spring training, we went down to Boca Raton.
Boy, that sounds like fun. I mean,
we really live life.
Dare you say what team he was on?
At the time, it was the St. Louis Cardinals.
Really? It was the Cardinal, okay.
But in Bucky Dent's, his cousin, and if you're a Red Sox fan, I know that's evil.
Well, that's what happens. So you were enjoying life, having fun.
We were, and we went everywhere we wanted to go. We did not have children. We tried, but unsuccessfully did not have children.
Any pets?
We have a dog now, and I could sit here for a week and tell you about my dog.
Well, okay. I will give you 5 seconds to tell the world your dog's name.
Her name is Lucky.
Lucky.
She got lucky with us, and we got lucky with her. That's a truly two-way street.
That's a good story. So you were.
But we were very active.
And then you had this just tube of blood, and then what did the doctors tell you? What was up?
He sent me to a group of nephrologists here in Macon, and like I said earlier, they followed me for 2.5 years just with routine blood work every 8 to 10 weeks, and there's a specific part of your blood work, creatinine or creatine, people pronounce it different, but we watched that for 2.5 years, and actually Dr. Terry, I guess I could say his name.
You may.
But,
I don't think anything bad will happen.
Dr. Terry, the nephrologist, he explained to me, he and Dr. Pesco both, explained to me very early in my disease that as my creatinine level increased, that I would have to, at that time, be transferred to a transplant clinic.
Yes.
There are only 5 in the state of Georgia.
Really?
They're all in Atlanta plus Augusta, the medical college. But we periodically did my blood work and some diagnostic tests. And when my creatinine got to 5.0, I went, and his nurse can probably tell you this verbatim, but I went to Dr. Terry's.
Incidentally, that's a high number. I'll insert
Yeah.
that. That's a very, it worries me to hear that number.
5.
Yes.
But when it got to 5.0 in April of '99, I went to Dr. Terry's office and I told them, I said, I'm halfway there. I don't like this, and I'm a big advocate on patients taking care of themselves.
Yes.
You cannot rely on your physician. You can't. I mean, not solely.
But you
for
have
your
responsibility, and just
if you have something out of the ordinary, you need to learn about it. You need to educate yourself, and you need to take care of
right
yourself.
thing. That's very
and
reasonable.
be very compliant with your direction. But when it got to the 5.0 and I saw Dr. Terry, I was just beside myself. He asked me what could he do to make me comfortable.
And you knew that was a bad number.
I knew it
was a real bad number.
Just with my background in medicine and,
Yes.
and hospitals and working with great physicians and everything like I'd had, I just knew that it was getting very severe. But Dr. Terry asked me what could he do to put me at ease, and I said, well, honestly, I would like to meet this transplant surgeon now.
Yes.
I would like to meet him on my terms.
Yes.
Not be more traumatized than I am, not
Right.
for it to be more dramatic than it
Yes,
is right
yes.
now. But while I've got time, I would
Right.
like to meet these people that
Yes,
you would like
yes,
to refer me
right,
to.
right.
And so he said, go home. He said, go home, my nurse will call you. So I went home, and the next day she called and she said, well, you will be admitted to Piedmont Hospital on April the 26th. And I said, no. You've got the wrong patient. I'm just going to meet a doctor. And she
Yes.
said, well, that's how you meet them.
Oh, really?
She said, you go in, it's a two-night, 3-day stay,
Yes.
and for your evaluation.
Yes.
And I had certain things I had to take with me. A letter from my dentist with dental x-rays and some things from my gynecologist. But when I left Piedmont Hospital on April the 29th of 1999, I knew from head to toe all I needed was a kidney.
Yes.
Everything else had been checked out from stem to stern.
So they did every single
They even
fiber
measured
in
my
your body,
organs,
every
everything.
single thing they could possibly, you were like...
They did. They went
zim
from
to
my
zam.
scalp to a
Zim to
podiatrist
nothing was
looking at my
nothing,
feet.
no sequence left after that. Is that
None
right?
whatsoever. There's even a 4-hour psychiatric eval.
Oh, really? Really?
There's even a 4-hour time period where a psychiatrist comes in, and because my husband was somewhat offended when he come in and asked him to leave the room, and he said, but this is with every patient, you know.
Yes.
And he explained when he went to leave, and he called my husband back in the room, but he did explain if this goes wrong, because
Yes.
things can go wrong during the surgery.
Sure.
Things can go wrong with the kidney post-op, and we can always find rejection on
Right,
the screen
yes,
someplace.
yes.
But they just really thoroughly, I can't speak for other centers, but Piedmont just really thoroughly examines the patient, heart, soul, mind,
Yes,
and body.
right, yes.
Just to make sure, because there are things that can happen.
Yes.
It's not as simple as getting your tonsils taken out and you
Yes.
go home and
Yes.
live happily ever after. I have lost some friends that had their transplants within a week of me having mine.
Yes.
I've lost 3 friends.
So that was a very stressful, no question about it. I mean, it was
Right.
really quite...
Because it involves vascular diseases at a certain point in time, and
Yes.
it can have a snowball effect.
So you left in a state of incredible anxiety and tension, and you were getting ready for a long wait. Is that right?
I did.
Maybe a year I'll have to live through this.
Right. They told me to go home. Very nice, compassionate people. And it takes 12 to 16 people to make up the average transplant team.
Really?
With everyone that you meet and everyone that you come across. But yes, they told me after I was evaluated to go to live my life.
Yes.
That it would be average 14 to 18 month wait.
Right.
And just if I went out of town or if I left home for any extended length of time, to please let them know.
Yes,
And they were
right,
getting me
right,
ready
yes.
for a beeper.
Yes.
Because this was just before cell phones got big.
Oh, really?
In 99.
Yes.
So this was right before everybody had pagers and cell phones, or that they were very common. But I come back to Macon, I come back to work, and a lot of the physicians that I worked with and everyone, they were very inquisitive, and I clued everyone in on where we were with
Yes.
everything. I had, and they also told me that if anyone was interested in being a donor for me, to have them called, my coordinator.
Yes, right, yes.
And I had 6 people, and through the phone interview process, 3 people were eliminated, and my mother was one. And
Right.
of course, maternally, she took it very hard. But I did have 3 people that passed the phone interview.
Well, that's rather, I mean, how did you feel? You had 6 people
Right.
that, if I could say it this way, loved you enough to say you can have my organ to live.
I still get real emotional about it.
Yes, yes.
And I pick on people. I speak at health fairs and other events on behalf of LifeLink
Yes,
and
yes.
another organization. And I tell them that those 3 people still get great gifts.
Yes, oh yeah. You
Because it
remember-
may be on the horizon. I might
Right,
need to
yeah,
call them one day.
oh, that's right.
So they get really good gifts on their
Okay,
birthdays
right,
at Christmas. But no, they just, I have a phenomenal family. But and we're all very close and
Yes.
deep rooted. But and thank goodness. But I come home and I resumed work at the hospital, and Ray and I traveled, and we still continue to do things on a regular basis. And on May the 28th of 1999, my coordinator called and told me that they were activating me on the UNOS, which is the United Network of Organ Sharers.
Yes.
But the UNOS list, which is housed in Richmond, Virginia.
Yes.
And some people call it the invisible list.
Oh, really?
But it has nicknames, and
Yes.
it just kind of floats out there in space somewhere. But I was activated on the UNOS list on May the 28th, and no one could have known, except for God himself, that I would only wait 10 days.
Really? You anticipated some very long period.
Exactly. And we thought that my family the 3 people would be tested. I would have a match. We would go into Piedmont with our little bags, and the surgeries would
Yes,
take
yes,
place. We
yes.
would go home several days or a week later. And but God had other plans.
Yes.
There was I don't want to get ahead of myself, but on June the 27th, I got my phone call that night. I had worked 12 hours in Macon on a nursing unit. Got home, got my call, and we had never had children, so I did not know what it meant to be someplace in 2 hours.
Yes,
or
right.
or like when your water breaks,
Right,
you've got to get
yeah,
up and
yes,
go.
right.
So that was our first taste of that for my husband and I. But and he was actually working in Atlanta that night, and we got to Piedmont.
So this was you had 2 hours.
2 hours. They
And you
called
were
me at
exhausted.
8:30.
You'd been suddenly just go. Right.
Exactly. With the renal disease, I had worked 12 hours, and I was extremely tired. And so my mother, my sister, and my brother-in-law came and drove me to Atlanta. My husband had me admitted when I got there. He'd had my paperwork and everything. But when it involves a transplant, you have to go in and show that you are you. And you have to show your Social Security card plus your driver's license.
Yes.
But we got to the floor. We got up to the 3rd floor to the renal treatment or the renal transplant unit, and my transplant surgeon was sitting there writing my orders. And I said, "Well, his name is Dr. John Welchel.
Yes.
Phenomenal guy.
Oh,
very
I
nice
know
guy.
him. He's quite a nice person. Isn't he?
He's a character.
Yes, very nice person.
He is very colorful. He is a character, and he
Yes.
is an answer to this girl's prayer. But he made us feel real comfortable. And my sister is a nurse and has been for many years, and she wanted to ask him not necessarily some bad questions,
Yes.
but the possibility
Sure.
of X could happen,
Yeah,
and this
sure,
X
sure.
could happen in different scenarios. And he told us, he said, it is such a perfect match. He said, I will not even entertain any questions of
Wow.
anything going
Wow.
awry. He said, it's just that good. And the next morning,
So this was at night. You had the surgery at night.
I got up there at 10:30 Monday night, and I was in the operating room at 5:30 Tuesday morning.
Wow.
Because they prepped me, and of course I had to start taking anti-rejection medicines right away
Yes.
to kind of let those start building up and everything, and antibiotics and that kind of thing. But they were doing different pre-op things all night long. Tuesday morning, I just like to tell this because it makes people laugh, but my family had been up. They didn't have the luxury of an anesthesiologist
Oh, really?
to help them rest.
Yes.
So they had been up since they went to work Monday morning.
Oh, really?
This was Tuesday morning. And Dan Reeves, the ex-coach, I guess, the player coach for the Atlanta Falcons, he was doing a book signing at Piedmont.
He was from Americus. Am I right on that?
Exactly.
Yeah, he's Americus.
Exactly. A good Georgia guy.
Yeah, right.
And he was on a book tour through
Yes,
Piedmont because
yes.
he had just had heart surgery there. And my family were all in this private waiting area, and he walked by with all of these TV cameras and newspaper people. And my sister looked up and said, "Coach Dan Reeves," and he come in and shook all their hands and gave them a book.
Oh, really?
And wished them well with whatever family member was there and what they were going through and everything. But so they kind of, I heard him talking about Dan as I was coming out of anesthesia, and I thought,
Yes.
I don't know Dan, I don't
Right,
know Dan.
right.
But so that was kind of our little thing that day that made everybody laugh. But the surgery was a total success. I had no post-op problems. I had no surgical incision problems. Just the medications.
You had to take a lot of medicine. Is that
The
right?
medications the side effects are just horrendous. But if I had the way I understand it now, with the way some of the medicines have changed in this almost 12-year period, if I had my transplant today, I would only be on prednisone the first 90 days. Where when I had mine in '99, I take prednisone every day now. I
Yes.
take a steroid every day as part of
Right,
my anti-rejection regimen.
And did you understand or ever find out who donated?
I did. He is a 28-year-old young man, very, very physically fit. Never smoked, drank, none of that. Christian family from upstate New York, Rochester.
Really?
And
So that's 1,000 miles away.
Exactly. And when they called on Monday, June the 7th, when I got my phone call, my coordinator from Piedmont actually told me to hold on. She said, "I'm not sure if there's music that plays, but I'm not hanging up." And I said, "What have you got to do?" And she said, "We literally have a plane at Delta at the gate at LaGuardia that we have to put this on, that your kidney on, to send
Yes.
it to Hartsfield." And that few minutes that I was on hold was just surreal. That was the most surreal part, I think, of all of it.
So your kidney was being flown by a jet plane
From LaGuardia to Hartsfield.
Yes, yes.
So,
Wow.
And I saw the carton and all of the airport stickers that were on it and everything. And at the time, they asked me, I had the option of keeping the carton. And I thought, I will never need that for anything.
No,
I'm just
no.
going to go back to work and live my life. And never thinking for the past 11 years I would volunteer with LifeLink in
Yes.
many capacities.
And so is that what you do? Do you do that? And so you've actually told your story many times. Is
Many
that,
times in many different settings, and I go back to Piedmont and mentor patients that are maybe thinking about transplant.
Yes.
Because a lot of people want to know the truth about the medicines and the
Yes.
side effects of the medications, and then the expense. It's
Yes.
very expensive. I don't want to make this political in any way, but it's just, I'm $3,200 a month sitting right
Really?
here in front of
Really?
y'all for 30 days.
Now, just to ask you a question, and maybe Lee, you can make a comment about this. I mean, we have the whole American healthcare system is it's changing. There's a tremendous structural changes underway. Is there enough money in the system now for the transplant programs, and is there an access issue about people being able to get? Or maybe I mentioned this to you privately earlier, but if you're a poor person, what goes on in those circumstances to be able to? That's a lot of money, $3,200 a month.
It is, and and that's just for the medications on a monthly basis. That doesn't include the transplant. Transplant is covered by insurance companies as
Yes.
well as Medicare.
Yes.
They cover all transplants if you're on Medicare.
Yes.
Now, again, you need to be referred to a transplant center for an evaluation,
Yes.
and depending on your condition, your
Yes.
diagnosis, you may not be a candidate for
Yes.
transplant. Now, on the other side, we have 110,000 people waiting for transplant today.
Is that right? Wow.
3,200 are waiting in Georgia alone. There's not enough organs to go around at the moment. We did over 25,000 transplants, but the list continues to grow at a rate to 10 to 20% a year because people are being added. we need more donors.
There must be some tragedies that happen as people wait for organs. Is that right? There must be some real tragedies that occur, and it's a terrible thing when that happens.
18 people die a day waiting for transplant.
Is that right?
Yes.
It must be a terrible tragedy for their families, and just the hope that some person will elect to donate their loved one's organs, or they've made the decision to do that. That's a huge deal.
Yes, and that's why we're out there talking in the public as well as working with the hospitals, trying to get the word out. Talk to your families about donation.
Yes.
Let them know how you feel. Let them know that you've signed your driver's
yes,
license or signed up on the donor registry.
Yes. Now, Lee, in my line of work, I often see situations where people have grievous injuries, and they've lost all neuronal function, and you could use the word brain dead. And those people, we have to face those circumstances and turn off life support. And during that period, you often have conversations, do you not, with families about those? Maybe you could just discuss that a little bit as to how that goes and what happens.
What happens is, if there's a potential brain death individual, the hospital will give us a call. We will come in and work with the staff to determine if this patient would be medically suitable.
Yes.
Now, when we talk about brain death, the brain has died. The patient has been pronounced legally in the state of Georgia by a physician. Most of the times we get a confirmatory and have two doctors say that.
Yes.
So once that happens and the patient is a good candidate for donation, then we work with the staff as far as talking with the family about the option of donation, or if their loved one has signed up as a donor, talking to them about honoring their loved one's wishes to become an organ donor. We talk about the process, what can be donated, what can't be donated, and how long it will take. And how we match the organs so the families understand the process, so they have a little knowledge about what they're doing. Again, this is truly the gift of life for the recipients. I have sat down with many families and have heard, if I can prevent another family from having to make funeral arrangements, something good has come of this tragedy. And my child is helping others to live. And that is wonderful. You know, in one sense, you have a family with a tragedy, but they're also thinking of other people that are having a difficult time and wanting to help them and truly save their life.
And do you communicate to the donor family what's happened, and they tell them some of the stories about the loved one's gift?
Yes, we follow up with the families with phone calls and letters. After the donation, we let them know what organs were able to be transplanted. We give them as much information about the recipients without identifying the recipients. And then most importantly, we let them know how the recipients are doing. And again, transplant has become very successful with the new drug therapies. Transplants are lasting longer, and Bitsy is a great example of that 12 years out. So families know about these, and at times they are able to meet some of their recipients. They correspond through letters to begin with, and then families and recipients want to end up meeting with each other, and we set those meetings up, and they are a great opportunity for the families to meet their recipients, and it's wonderful to be part of that. Words can't say enough about
Well, it's been I guess a gift for you two to be here tonight, and I thank you so much for coming. Certainly, I think there's nothing more important than the sacrifices that we can hear about. I mean, how noble people are that do that. And it's good to meet both of you tonight, and we hope you'll continue with your good work. And so thank you so much for coming.
Thank you.
Thank you.
This program is brought to you by the Georgia Neurosurgical Institute. For over 50 years, rendering neurosurgical care to patients of all social conditions, treating complicated problems involving the brain, spine, spinal cord, and peripheral nerves, endeavoring to encourage quality care, medical research, innovation, and education on a local, national, and international basis.